To understand why that name, Vivian Thomas, mattered so much, you have to go back to Baltimore, back to the 1930s. Back to a moment when the most important surgical innovation of the century was being invented by a man who wasn't supposed to be in the room. Alfred Blalock was a brilliant, ambitious surgeon. He arrived at Vanderbilt with a big question and a bigger ego, and he needed someone extraordinary to help him answer it. In 1930, a young black man named Vivian Thomas walked into his laboratory desperate for work after the Depression destroyed his college plans. Blalock hired him as a janitor. Within months, everyone in that lab knew they were in the presence of something remarkable. Vivian Thomas had taught himself surgical technique. He could suture blood vessels with a precision that trained surgeons envied. He could design experimental protocols with the mind of a scientist. His title said janitor. His work said something else entirely. When Blalock moved to Johns Hopkins, Thomas came with him. And that's where they met Dr. Helen Taussig, a cardiologist who had spent years watching children die from a condition called tetralogy of Fallot, blue baby syndrome. Their hearts were broken in 4 places. Not enough oxygen reached their bodies. They were blue, their lips, their fingernails, and most of them didn't make it to adulthood. Taussig had an idea. What if you could build a detour, a surgical shunt that rerouted blood to the lungs? She brought that idea to Blalock. Blalock brought it to Thomas. What happened next is one of the most extraordinary and troubling stories in American medicine. Over the course of several years and nearly 200 laboratory procedures, Vivian Thomas developed the technique. He designed the instruments. He refined every step. And then he stood behind Alfred Blalock in the operating room and guided the surgeon's hands through the procedure he had invented. On November 29, 1944, they operated on a 15-month-old girl named Eileen Saxon. She weighed 9 pounds. She was blue. When the shunt was completed and her color began to change, when the blue faded from her lips, everyone in that room understood. Something historic had just happened. Eileen didn't live long. The damage to her heart was too great. But she lived longer than she would have. And thousands of children after her lived because of what Vivian Thomas built. The procedure was announced as the Blalock-Taussig shunt. Vivian Thomas's name was not in the record. For decades, the world did not know what the people inside Hopkins already knew. But one of the people who did know was a young resident named David Sabiston, Blalock's protege, my future mentor at Duke, and Sabiston never forgot. Sabiston went on to become one of the most celebrated surgeons in the world, author of the definitive surgical textbook, chairman of surgery at Duke. But he spent decades quietly and persistently fighting for the recognition of his friend. He wrote about Thomas. He advocated for his portrait at Hopkins. In 1976, Johns Hopkins gave Vivian Thomas an honorary doctorate and hung his portrait in the hospital. It was late. It was incomplete. But it happened. There is one more thing about Vivian Thomas that I didn't know when Sabiston mentioned his name to me. Thomas had a learning disability. He navigated a world that measured intelligence through credentials he was never permitted to earn, and he did it through sheer force of mind and refusal to be defined by other people's ceilings. I think David Sabiston looked at me, a young black man with a learning disability, trying to get into surgical training, and he saw his friend. I think that's why he was warm. I think that's why he said the name. I didn't understand it then, but grace works whether you understand it or not. In part 3, I'll tell you what all of this means. Not for surgery, not for history, for the kids who look like I looked, and for the kids who don't.